time. So, Assalamu alaikum, everyone. Good morning, good afternoon, good evening, depending on where you are joining from. And I'm delighted and excited to welcome you again to one of the next in the series of our webinars. So, just to give a quick background, is that this is the webinar series from the the Association of Pakistani Physicians of North America, or APPNA, Medical Education Research and International Training and Research and Transfer of Technology, or MERIT subcommittee. And we've been doing a series of webinars where we are looking at the healthcare research and innovation landscape in Pakistan, and we are doing this every other Saturday, so 2 times a month or every 15 days. And my name is Sarfaraz Hasni. I'm a rheumatologist and the director of lupus clinical research at the National Institutes of Health in Bethesda, Maryland. And today I have a distinct honor and pleasure to welcome the leadership group from the very esteemed and well-known Peshawar Institute of Cardiology and Institute of Medical Teaching Institute, or MTI. And we have 3 presenters from there. And the first one is the leader or the director of the institute is Dr. Professor Shahkar Shah, who is the senior cardiothoracic surgeon and the medical director and dean. And then we also have joined by 2 other colleagues, Dr. Mohammad Tariq and Dr. Mohammad Waleed. Dr. Tariq is a cardiac surgeon who was trained at Khan University and fellowship from Canada, and he's the associate dean for academics. And then Dr. Mohammad Waleed is an intervention cardiologist and was trained in UK. And after that, he came back to Pakistan, and he's the associate dean for research. So we have the main dean, the academic dean, and the research dean all here. So, and then our panelists are, as usual, Professor Dr. Sayed Uzair and Dr. Umar Hayat are here. And just some housekeeping rules are that we try to complete the presentation in about 45 minutes. And if you have any question and answers, please put them in the Q&A box, and then we will have the opportunity to entertain those questions for about 15 minutes or so, and also have a robust discussion by our panelists. So without further ado, I would now hand it over to Professor Dr. Shahkar Shah to please take it away. And then after that, I think it's Dr. Mohammad Tariq and Dr. Mohammad Waleed who will be talking about the academic and the research activities of the Peshawar Institute of Cardiology in that order. So please welcome again, and thank you again for all the participants to join. Professor Dr. Shahkar, please take it away.
Thank you, Sarfaraz, and assalamu alaikum, all our friends in America, all our APPNA friends, and our guests in Pakistan as well. I'll just briefly introduce myself. I'm Shahkar Shah, and I'm a 1978 graduate from Khyber Medical College. I trained in general surgery and then in cardiothoracic surgery in UK. And I've been a consultant cardiothoracic surgeon for almost more than 36 years. I've worked at various places in Pakistan, from Lahore, Peshawar, and my last job as a senior cardiac surgeon was at Shifa Hospital in Islamabad. I also worked for about 10 years as a senior cardiac surgeon in Saudi Aramco. So that was basically about me. I'm the medical director and the dean at Peshawar Institute of Cardiology, and I have my 2 associate deans in the panel as well, who would be essentially doing most of the talking. One would deal with the academic side, and the other, Dr. Waleed, will be talking about the research side of PIC. So PIC has essentially 3 pillars: our patient care, and then academics and research. I'll just give you a brief history of Peshawar Institute of Cardiology, because many of you may not be familiar with this institution. It's just very new. It's only about 2.5 years old. And the PIC project was conceived in 2005, and 33 canals of lands were taken from Peshawar Development Authority, and then once the land was allocated, then very little work was done, and then the actual civil work started in 2010, and the structure got completed in 2017. Then the building was literally abandoned till funds were actually allocated in October 2019. And within almost a year, we got the hospital going. The hospital was inaugurated by Imran Khan in December 2020. And within a week after that, we did our first open heart surgical procedure. Briefly tell you about our clinical work. Before that, sorry, I'll just tell you about the hospital facilities. It's almost 300 bedded hospital. We've got 55 critical beds, both for cardiology and for cardiac surgery. We've got 6 cath labs, 6 operating rooms, and our staff is almost 1150 people are working at PIC. In the first year, we saw about 38,000 patients in our outpatients. But the next year, this got doubled to about 71,000, just above 71,000. And in first 5 months of 2023, we have seen more than 38,000 patients in our outpatients. Our average yearly ER attendance is about 10,000, and it's getting, getting more and more busier. It's a specialty hospital, so we have obviously cardiology, both adult and pediatric cardiology. We have adult and pediatric cardiac surgery, and then we have supporting units like nephrology and pulmonology. We also have a very well-equipped diagnostic setup, cardiac imaging. We have CT angios and cardiac MRs and all the rest of the paraphernalia. So in the first year, we did almost 5,500 interventional procedures at PIC. In 2022, which is the following year, the cases almost doubled up to just above 11,000. And in the first 5 months of 2023, we are close to 6,000 interventional procedures. These include both adult and pediatric interventional procedures. On the surgical side, in the first year, we did 1,150 cardiac surgeries. Second year, we got better number, but we had been hit by a very bad deep sternal wound infection, and we had to shut down our theaters 2 or 3 times over a period of 3 to 4 months. This year, again, the numbers look a little bit down because we have supply chain issues and we are not getting enough oxygenators. So we have essentially rationed our oxygenators, and we are doing almost half of our work now is beating heart surgery. So we have a potential to do 2,500 cases a year, but at the moment, because of the supply chain issues, we are struggling a little bit on the surgical side. So you'll be happy to know we met all our first year strategic goals, which were approved by our Board of Governors. We were the first public hospital in Pakistan which got certified in 18 disciplines by ISO 9000, and that was last year in January. So almost within a year of our inception, the hospital was certified by the ISO. Only this week, we also got licensing from the Health Commission as a Grade 1 hospital, which is the highest grading that you can get. And we got very good reviews from the Healthcare Commission. We are working our way towards being the first public hospital in Pakistan to be JCIA certified. We are running a little bit late because we have to do some civil works to improve our fire safety, and that is taking time. So we are targeting June 2024, around the date that we will have our audit from JCIA. We are also planning, the same way that the NICVD in Sindh did that, we are trying to open a small PIC satellite facilities in major urban centers of Khyber Pakhtunkhwa province. And our first hospital is actually going to be opened in Bannu, which will take care of all the southern districts of KP and the southern tribal territories, Waziristan, North and South, as well as Dia Khan, Bannu, and Kohat. So the government has already approved that, and we are going to get the budget in this financial year. So I'll just conclude my brief talk. PIC is just 2.5 years old, and we have 100% achieved all our short-term strategic goals. We have opened all our services. We are doing pretty well on the academic side, and we are also now galloping ahead on the research side. So we've got essentially 3 pillars. I've spoken about the patient care, and then soon you'll be hearing Dr. Tariq, who is the Associate Dean in Academics, and Dr. Waleed, who is the Associate Dean in on the research side, and they'll be, inshallah, talking to you about their own programs. And with that, I again thank APPNA to connect us, the PIC staff, to APPNA and introduce ourselves, and we hope that we'll be able to develop long-term links with, especially with the cardiologists and the cardiac surgeons belonging to the APPNA organization. Thank you so much. I appreciate it.
So, Dr. Shahkar, if you stop sharing, then I think the next presenter can share the presentation.
Okay, yeah.
Dr. Mohammad Tariq, please.
So, Assalamu alaikum, everyone, and
Dr. Tariq, if you can
use...
go to the presenters mode from...
Yeah, so can you see that now, right?
Yeah, we can see that now.
All right, so Bismillahirrahmanirrahim, and Assalamu alaikum to everyone, and thank you again to the whole APPNA team for, firstly, we met few of them actually when they were in Pakistan earlier this year. And that's where things started moving, and we have been in contact with, mostly I myself have been in contact with Wazir Saab. And then this is part of kind of, linked to that meeting, which Shahkar Saab arranged actually. And that was just a social visit though, but it is now becoming a reality and being converted into a real long-term relationship. So I'll just quickly go through the academic part. And what are we having at the academics are we running? So basically, it's a so the deanery here works as such that we have a dean, and there is an academic part and research part. So we, Shahkar Saab is leading the whole thing, and along with the clinical side as well. And I'm personally looking solely through the academics, and then Waleed Saab is taking care of the research part. Clinically, we have cardiology and cardiac surgery. Those are the major stakeholders clinically, and then we have anesthesia, critical care, pathology, radiology, nephrology, and pulmonology. So these are the supporting services, being a specialty hospital. So those departments are helping us in running our services. Just a few things about which we kind of achieved in the last year or two. So it is the only dedicated cardiac center in the province, in KP. Other hospitals do have cardiac units, but just like a ward or a small unit or department. But this is a dedicated, separate, wholly solely cardiac center. We made history when we got postgraduate recognition within 6 months of our inauguration, and that was kind of a milestone in itself with CPSP, when we got recognized for 4 specialty trainings, and they were postgraduate programs, fellowship programs with CPSP, College of Physicians and Surgeons, Pakistan. More than 90% of our records and our work is online now, and we have an established digital record system on our own server now, and we have our own database that is actually given to us by Shahkar Khanum, and we have almost implemented that more than 90%. We are the only center who in KP who are recognized for pediatric intervention fellowship program actually. And we are currently the largest pediatric intervention, running the largest pediatric intervention program. We are the third in intervention cardiology all over Pakistan now. And hopefully, as we add further numbers to that, by end of this year, probably we will be coming somewhere in the top, maybe first or second. Recently, we did some naive procedures, very one of its kind in Pakistan, and we have started TIV programs and now percutaneous pulmonary valve implantations in pediatric and congenital patients as well. The other important thing is that we are the first public sector hospital or an institution who acquired actually a simulation lab for our training programs. And now, and recently, about a few months back, we started the first ever wet lab on animal hearts for cardiac surgery in KP. The postgraduate recognition goes as such that we file an application, then there is certain criteria for number of beds, for procedures, number of patients, and then you have to have supervisors recognized by the CPSP. After meeting those criteria, you file an application, they physically visit the facility, they look at all the things, then there is a joint session where they're briefed and they ask questions. After their whole visit thing, and if they are convinced that yes, this institution is capable of taking care of trainees and can train people well, so then you're given that recognition. And so in the first go, we actually had first fellowship. So we were given accredited programs for FCPS. So the first fellowship is in adult cardiology, cardiac surgery, and general anesthesia. And now we are offering second fellowship that is after the first, like they complete their FCPS, first FCPS, and then they do a second FCPS in interventional cardiology and pediatric cardiology as well. And in the near future, we are looking forward to get recognition for our cardiac anesthesia. We're going to introduce aortic and structural heart fellowship programs, EP and imaging, nephrology, pulmonology, and pathology as well. We have collaborations with our sister institutions and certain other hospitals, and we are supporting each other in achieving those academic goals which we have set. And so mostly the post-graduation programs are recognized by CPSP. Healthcare Commission looks at the overall hospital grading and performance. PGMI is the Postgraduate Medical Institute for the whole of KP, who recruits the residents, and they have a very well-established system of recruiting those residents and getting the trainees in all the specialties which they have affiliated, and then they send us those residents actually. So PGMI is the government body who is paying for those residents, and they are giving their salaries and stipends. And then we have few MOUs with Khyber Medical University, and a few of them were very recently signed. We have MOUs with Shahkar Khanum, Houston Methodist Research Center, We are already working with them on a couple of projects. They were held in between, but now I hope they will be, and Waleed Sahib is going to talk about that. London School of Economics, we had a collaboration in some research part of that as well. And again, Shahkar Sahib or Waleed Sahib, they are going to they talk about that, but that is part of our achievements, MOUs and all that. Shifa International Hospital and Aga Khan Hospital have been helping us since day one, and they've been very kind enough to help us through these 2 years actually. We have an established HMIS system, which is patient records and all the data that is online now, and more than 90% compliance have been achieved. We have a dedicated registry for cardiac surgery, that is DBS CTS, and that is in association with the Pakistan Association for Cardiovascular and Thoracic Surgery, the Pakistan Society for Cardiac Surgery, and we are now part of that. And we recently achieved 100% completion of data, and we are now 100% compliant for our cardiac surgery. On the cardiology side, we have certain registries, that is CROP, heart failure, CAR-T, PAC-Sehat, and left main PCR registry. Waleed Sahib is going to talk in detail about that, but I'm just going to give you a glimpse of that our trainees are now using these databases and these registries as their regular part of academia and their presentations and their research work, and they are trained in all these databases as well. So as far as the curriculum is concerned, so the basic curriculum that is provided to all the hospitals affiliated with CPSP. So there is a basic curriculum which is designed by the college. So that is the minimum that you have to achieve. And they have their clinical and academic and research parts defined. And then they have their other grooming parts defined as well, like communication skills, professionalism, and all other activities. On top of that, we have added a few things from our side to improve it further. So we're not just sitting on the college manual, but we have actually topped it up with our own, manuals as well. And we have a very strong academic program now for all the 4 specialties, and they are running very robust academic programs in all the specialties actually. Just to give a brief thing about the academic activities here. So we have a dedicated almost daily supervised academic sessions in the morning. That's how the morning begins. And then we have a heart team meeting, that is a multidisciplinary team meeting where all the cath cases, the complex cases, and all those cases which needs more than one brain are brought to that meeting, and that is on every Tuesday, and it's a mandatory meeting every Tuesday since we have started. This activity has been going on, and residents present their cases in that, and then a decision is made. General club sessions, again related to scholarly activities, that is a mandatory session for all the residents. We have regular morbidity and mortality meetings. Every department does their audit, and they look at their morbidity and mortality, and they have to present those morbidities and mortalities at their departmental levels, and then the data is shared with the higher management as well. On Thursdays, we have the grand institutional rounds. Initially, because we did not have a lot of research or a lot of stuff to work on, and the research took time, so we started at least with some grand round presentations. More were academics, and some were training sessions and all that. But now the grand round, the institutional grand round, is being converted to actually present the research work conducted at PIC, and then we'll be taking it on from there and present elsewhere as well. So and then we have quality assurance rounds. We have a very strong quality department who is taking care of the quality assurance, and they have a grand round quarterly. So 3 monthly, they give us their reports on the compliance of various KPIs and various, so that includes the clinical part, the academic part for every department, and that is shared with the departments, and that is quarterly actually. So these are the mandatory activities for as far as academics are concerned. Then we have certain intermittent sessions. They are already scheduled for the next few months, and they're run in a very regular fashion now for the last 1.5 years or a year or so. We have been very regular with these sessions now, and these include all our involves our faculty, our doctors, nursing, supporting staff, and everyone, and giving them lectures and giving them hands-on trainings. And so these sessions are now regular part of our academic activities actually. We have a very strong workshop schedule now, as we have the simulation lab now fully installed, and we have vet lab, and we have other facilities within the institution now. So we are conducting regular workshops for our trainees, for our staff, for even for the faculty actually, and in-house and outstation vet lab, simulation based learning. And we were lucky that our own faculty was involved in these sessions, but also there were some foreign physicians of Pakistani origin who actually visited for specific workshops to the PIC, and some were in Pakistan, and they were on vacation, or they were here in Pakistan to meet their loved ones. So we invited them for those guest lectures and training programs, and they were kind enough to come over and give us some time on those workshops as well. So our main focus from the academic side has been on these academic sessions and meetings and hands-on trainings on workshops actually. All these programs have go through we have a very strict monitoring and evaluation system for them. We have the educational rounds and academic sessions. Their data is documented and shared with all the stakeholders and the management. We have the institutional rounds and the quality rounds, and all the data is shared. We have a mandatory quarterly evaluation of every resident and fellow who is currently under training at PIC. And that evaluation form, I may be able to open that if I can. And this is the evaluation form which is filled for every resident 3 monthly. And that is actually a 360-degree feedback from the resident, from the supervisor, and from the co-workers on their as to how their training is going on actually. And then we have recently formulated this annual appraisal form and evaluation system, which will soon be introduced as a mandatory part of annual appraisal and their promotions to the next year, and then allowing them to get through their exit exams actually. Apart from that, we have introduced most of it. So this is the promotion criteria and the assessment criteria for all our residents. And this is almost in the final shape now. So this is the criteria they have to achieve. That is attendance and mandatory workshops, research papers per year, at least satisfactory and persistent quarterly evaluations, 4 of them per year, and 1 national or international presentation at any conference. And then we are introducing an end of year exam. So they have to score in that as well. Apart from that, they have to complete an e-log book, where they enter all their cases, which they observe or perform or assist, or any kind of clinical or academic or research works they do. They actually enter that into an e-log book, which is provided by the CPSP and online registry. They have to enter all their patients' data into our databases, which are the relevant databases which we have currently, and the registries. And then residents are now actually the main focus and main participants in all the research projects which are currently going on at PIC, and Waleed Sahab will be talking in detail about that. So far, our 9 residents have completed and passed their FCPS exit exams actually, and they are promoted now to experiential, that is the senior registrars, or I may say, instructor post actually. Some few call them instructors, and then the other terminology is senior registrars, and those are that is the step to becoming before becoming a consultant actually. So they have to spend at least a year or two on senior registrar after exam to become a consultant. We our 2 residents have recently gone for they got their paid fellowships accepted, and they left for their second fellowship to UK in cardiac surgery actually. One of our cardiology residents was awarded with an international scholarship for an imaging course in the US recently, and he went there in that was a paid paid imaging rotation over there. Another of a resident had won the AATS, the ATS Resident Scholarly Award for a paid rotation, and he'll be leaving for Ottawa actually, and that is also by the ATS, which is the American Association for Thoracic Surgeons. 3 residents won their prizes for case presentations, and we have been regularly now presenting at all our national and regional conferences actually. So we are kind of introducing new or opening new eras in the current system for education and training. And so the wet lab, we have wet lab was introduced by PIC actually, and today actually I went to another institution who arranged wet lab, and I was part of that. But those are the first steps. The foundation is laid down by PIC actually, and now other institutions are following us. We were the first one to gather all the cardiac surgeons in KP and conduct the first KP cardiac surgery grand round, and now other institutions are following up with that. So these conferences are basically to share, to invite all these surgeons from KP, and where the residents and fellows pick up their research projects or their interesting cases, and they are the ones who are presenting at these forums actually. And lately, the previous one which we conducted, PIC got the first prize for that. So far, we have conducted the Pakistan Society of Interventional Cardiology conference in 2022 here at PIC. We recently, last week, conducted our pediatric cardiology conference, and there were guests from Pakistan and abroad who participated in that, and PIC hosted that conference actually. The first KP conference, again, the Pakistan Society for Surgeons, was hosted by PIC. This was about a month back. And the biggest event for this year regarding conferences is that the 12th biennial Pakistan Society meeting coming at the end of this year is now given to PIC, and we are going to host that conference, and we are going to conduct that conference in Peshawar actually. And delegates from Pakistan and all over the world are going to come over and participate in that conference. Just concluding coming to the actual thing now. So future plans are we want to move from prevention to cure. We are overburdened right now. We want to start programs to start taking care of these patients on the prevention side as well. As Shahkar said, we are planning to open few satellite centers that will work under the umbrella of PIC. We are in the process of working out our relations with universities and institutions and hospitals abroad, where Pakistani origin physicians or other physicians who are in the academic and clinic, the training programs are directors or supervisors or at a certain position who can help our trainees to be helped out with those opportunities for their fellowships abroad actually. And then we are looking forward for academic and research MOUs, and we want to be part of trials and to get those grants as well. We have our hopes very high, and we are pretty hopeful that probably we have achieved a lot of things, and we were the first to start off a lot of things in cardiac care services in KP, and we are looking forward for the first University of Cardiac Sciences in Pakistan, and PIC is going to be that inshallah one day. So APPNA platform, thank you again. Thank you to APPNA. Thanks to everyone for inviting us and giving us this opportunity. From academic side, I would request, and I would be very, to be honest with you, I'm very concerned about all the trainees in training programs, so that they get some exposure abroad, and we develop those links, and so that our trainees can be provided with fellowships or attachments or rotations abroad, and they can learn from that environment as well, apart from our own training, and that will add a lot to their training and their knowledge and their skills throughout their career, and that will be a big plus to their careers actually, and serving the community. And then we're looking forward for exchange programs. That is one of the strengths which we will be working on, and that is that our residents and fellows can go abroad, and residents and fellows from there can come here to Pakistan. Then we can actually teach them or give them just a taste of or part of this the disease we are having and the problems we are dealing with, and that will be a lifetime experience for our trainees to go there, and for their trainees and your trainees to come over to Pakistan and see the disease pattern and other associated issues as well. And this academic and clinical excellence or training, further trainings are not just limited to our fellows. We can have our faculty sent over for certain workshops, trainees, nurses. We are focusing on a lot, nursing staff and allied services. We would be very glad if we can have our guest speakers or facilitators and trainers from APPNA platform to come over to PIC to have lectures, workshops, hands-on trainings, and staff to support our staff education programs. Finally, we all know the current situations and the financial constraints that we all go through, and specifically in a public sector hospital. So fundraising has been an issue, and funding these academic sessions and exchange rotations, and then research work, sending and accommodating these residents and fellows for further excellence and education, and sending them over even for presentations actually at conferences has been challenging. So that is something which we are looking forward to. Research opportunities, humongous. I think the volume we have, the trainees, the number of trainees we have, and the kind of diseases we have as per cardiac diseases are concerned, we have a lot to offer on the research side for that. I would conclude here. This is a nice picture. We recently developed a special daycare for our staff's children, and the same for pediatric ward has been converted into actually a lovely play area. And I thank you all once again, and I'll finish it up here.
Thank you so much, Dr. Mohammad Tariq. And now we will go to Dr. Mohammad Waleed for his part of the research, part of the training. So Dr. Mohammad Waleed, you can share your screen. Thank you. Okay, and I'll just change it to the presenters mode. I mean the presentation mode. Okay, perfect.
Right.
Waleed, it went back to the presenters mode.
Went back.
Okay, now it's good.
Good. Assalamu alaikum. Good morning, evening, and afternoon to everyone. Thank you, APPNA. Thank you, Dr. Sarfaraz. And thank you, everyone who is involved in putting this effort and to giving us the opportunity for presenting from the PIC. I will not take too long. We'll be focused mainly from the research side of the Peshawar Institute of Cardiology. I'm a clinician by background, structural and interventional heart cardiologist with a special interest in research, and started developing interest in research when I did my master's in public health from University of Sheffield, and then took it on forward along with my clinical side. So let's meet virtually the PIC research team. So overall, everything, all the activities are supervised by Professor Sayyid Shahkar, Hussain Shah Sahab. I'm looking as an associate dean of research from the research activities, and we have got 4 research analysts. The main reason why I'm putting this slide here is just to highlight one main point, that we have got very strong research framework. There is a strong manpower, and there is a capability to push further from here onward. So these 4 research analysts help us in every research activities that we are involved in, from the data collection moving onward. And we have also got that dedicated research database transcriptionist. And now you may wonder that why we need dedicated research database transcriptionist, as in most parts of the world is usually the operator's responsibility to do the data entry for the procedures performed. And our surgical team are doing great from their point of view. The surgical operators, they're doing their own data entry for the procedures. But from the cardiology side, because we have got so huge number of cases and the volume burden is so high, that on a daily basis, almost we do like 70, 80 procedures. So along with the operators and the fellows, we need dedicated research database transcriptionists as well to help us to achieve the target. This is like the main focus since I have joined Peshawar Institute of Cardiology. And one strong message from the whole team, right from the start down to everyone, that we need to achieve 100% data entry. And we are on it from November onward to achieve the data 100% up to almost 100% data entry for the majority of the procedures that we do over here, which is the one of the very strong point for the PIC research side. Then data analyst, we are actively looking for a data analyst at this point. We had a very wonderful guy, but who then got selected for his PhD in statistics in Glasgow. Apart from that, we also have got a librarian and an associate librarian, which does help the fellows in literature search for conducting their studies, and also train them how to do the literature search. And also to mention about a dedicated research associate whose main job is to collect the data, follow the patient journey of the heart failure patients. This post is funded by the Getz Pharma, and at this point we have recently started to about the heart failure data collection. And at this point, we are concentrating only on the inpatient heart failure admissions. And hopefully in future, we have got plan to extend the data collection towards our outpatients as well. Now, on the top, we also have got 2 very strong research-related committees, the Ethical Research Committee, which is essentially a backbone of the research, and also the Institutional Review Boards. And so far, in the last 2.5 years, we do have a regular meetings, almost quarterly meetings from the ERC point of view, and the IRB meets regularly as well. 160 plus of research protocols and synopsis has been approved, and some of these have made it already into publications, while the other projects are near to completion and either submitted or we are awaiting responses from them. And you may be surprised at why I have put an overall bracket on the ERC and IRB, because we have defined our TORs for both of the committees. And if the research proposal or the synopsis or dissertation proposal is from the PIC, because we have got a huge number of juniors over here, then it usually goes directly. We have already clarified pathways to the IRB committee, and which every week clear and decide and regularly meet and either suggest any changes in the proposal or approve it, so that there is no any delay in start of the research work and start of the data collection, and if that needs to be improved, also the submitter and the supervisor get feedback very quickly. Now, not to forget about the main people who are involved in the research are our trainees, registrars, the fellows, the faculty members directly. They do their they lead the projects as well, and also they supervise their juniors. And also recently, now we have started getting students, both medical and from the paramedical point of view, and I will talk a bit more about in my next few slides as well, who are actively very keen, and we are exposing them how to get involved in the data collection, keeping in mind of the ethical considerations, and training them as well. Now, just to give you a glimpse of what we are doing here in PIC and where we are at the moment. So, as a research team, we are contributing to our national databases. So the first is the CROP PCI, which stands for Cath Lab Registry of Pakistan, National Registry. And so far we have contributed almost 7,000 patients. And when I say so far, it is only in the last 7 months, from November 2022 up till end of May. And if you look at this, like in 7 months, it's almost 1,000 cases per month. So 1,000 cases per month is like one of the highest centers that are doing the number of procedures and contributing the data into the national databases, which is available then at any time to analyze either by us as an institution or nationally if we are generating any national papers or any research projects. And if you look at kind of PCI burden is almost 50 to 55%. Out of this 7,000 patients, 35,000 are PCI. Recently, we in the annual report, and this data which was presented in Park Life from the Pakistan Society of Interventional Cardiology side by Dr. Bashir Hanif. If you look, the Peshawar Institute of Cardiology is the third highest center in the country. And having said that, this is only 2022 data for November and December. So only on the basis of 100% data entry of 2 months, we are the third highest center in the country. So this year, I'm pretty hopeful. We are on target. We're achieving more than 95% of the data entry from January onward. So we will be the highest center contributing and doing the cases burden in to the national databases. Now, moving on to the second database, national database that we are contributing is the CROP heart failure. Recently started, signed an MOU with the Pakistan Cardiac Society, and we have got the 65 entries so far. And the third one is the national database that we are contributing is the database of the cardiothoracic surgery. Surgical side are also doing a great job. They're very well up to date. They do weekly checks of their data entry as well, and then do the monthly checks of the data entry as well in order to avoid any missing of the data entry. Apart from that, we also contribute in the international studies. We are one of the center that we are contributing into the ACC GARTI study, Global Heart Attack Treatment Initiative study. And we do regularly our quarterly data submission. The last quarter data submission was just a few days ago. And again, this is one of the area, if you look, the list is not huge. So that's what we want to kind of extend more, and we'll need help from the APPNA platform. That this is an area that we need to focus a bit more. We have got a potential, but we want to grow here. We want to involve more and more in the international studies and trials. Now, moving on to my next slide. We also are involved in the national studies. Currently, we are one of the 7 centers, and the second public sector center who is involved in the Pak Sihat study. It is one of the largest prospective cohort study in Pakistan, aiming to recruit 2,000 plus patients. And it's mainly, I will not go into too much details of the study, but it's mainly looking doing the atherosclerotic assessment in asymptomatic healthy individual patients. And also we have developed our local structural data collection. So in future, we can then looking into interrogating it with the international databases in terms of our TABI work, we are collecting the data for our Leftman PCI and for our CTO's procedures. And also we are one of the centers which regularly and very religiously do our weekly cardiology, cardiothoracic MDT meetings. And we have submitted a paper about our MDT meetings so far that we have done, sort of cases we have discussed, how are they followed up, what were the outcome, what was the time from the decision to this, and awaiting response about this paper. Now, just to give you a glimpse of PIC publication, again, I will not go into too much details of each and every paper we're here. The one highlighted has already been accepted and published. And the other ones are which has either been submitted or near to completion or already been completed. If you look into the highlighted one, which has already been published, a few of them are already PubMed cited, and one of the paper where Professor Shahkar was involved with as well was leading from the Sihat Sahudat card paper, has made it to Lancet as well. And this is again our growing area. We are working very hard on it. As we all know from the research background, research is usually not a quick result thing. It takes time. It's a time-consuming thing, but we are putting our maximum effort on it with our team and colleagues and everyone else. Now, apart from publications and things, we are also involved in other activities, and I will only slightly touch base on these few MAUs which have got a strong research component into it, including the MAU with the Khyber Medical University. So now our clinicians will be co-supervisors on the projects which will be which are kind of the proposals has been agreed on with the Khyber Medical University. Recently, we are also starting two diploma and certificate courses in the cardiac rehabilitation and the health prevention program. The curriculum for both of these courses has been approved in the national academic meeting, and we already have got. I've put few things here in the bracket just to highlight that how strong we have got the structure over here for the cardiac rehabilitation and health prevention, because this is kind of a forgotten or not too much focus over here. But in PIC, if you see from the cardiac rehab post-ACS patients, we already have got a dedicated dietitian clinic to advise the patients about the healthy lifestyle. So after ACS, after the patient is being treated, the patient, you will come and see the cardiologist as well, then will be seen by the dietitians. We are the only public sector hospital in the Cape who have got the fat analyzer and will advise the patients according to their weight reduction on the basis of the percentage of the fat. We have got a dedicated and strong physiotherapy team. And recently we have started a dedicated heart failure clinic once a week as well. MOUs from the research point of view with the Pakistan Cardiac Society, Khyber Girls Medical College, and the last one from the research point of view is the Institute of Leadership Excellence, and this is the research and education wing of one of the pharmaceuticals, Pharma Evo, and we are in process to sign an MOU from them and for the research activities and workshop. And with their assistance, we have managed to arrange a 2-day SPSS data analysis workshop here in PIC. It was a very good workshop, 2 days hand-on experience. Directly, the candidates very well attended. The candidates were directly trained by a professor of statistics from the University of Karachi. We also conducted a literature search workshop for the beginners. Just in kind of to summarize from the research point of view, I've touched already on the few points that we've got a very strong framework at PIC. There is a very dedicated and enthusiastic team. There is a robust data collection and entry, which needs to be looked into from various perspectives, and various projects and research proposals can be drawn from that. And this is easily available to us. We also have got an access to the national data as well. And the other strength from the PIC point of view, we are one of the highest patient workload point of view from the cardiology intervention point of view. And then obviously conducting any studies with such a high number of patients is obviously one of our strengths. And also this part of the world has got opportunities of research to look for unique diseases which are specific to this part of the world, which are not more common in the other part of the world. Diffuse coronary artery disease, rheumatic heart disease, and a lot to mention over here. The challenges that we are coming across here from the research point of view, obviously the research is a growing field. People are overall, the culture over here is people are slightly reluctant to dedicate time and efforts to research. So it's not only a PIC problem, it's overall as a growing field in Pakistan. And the main problem that we are facing here is there is a lack of dedicated research funds. A few of our abstracts and one of our fellows under our supervision, he did a very innovative work about and even developed an app which guides us how to do the CTO procedures. And then it got selected in one of the high standard international EuroPCR meeting. But unfortunately, we could not fund him to go there and present his innovative work. So this is one of a very kind of a point that we're challenging that we are facing here. The other area that we really want to improve is to be involving in the international studies. We do have got a platform. We are already involved in some of the studies, but we want further collaboration with organizations like yourself, the APPNA, and other international centers, so we can grow further. We can do combined projects. We can be supervised and involved with the studies bilaterally, so that we can move on together as a family and as a community. Thank you so much. That's everything from my side.
Okay, great. Thank you so much, Dr. Mohammad Waleed and Dr. Mohammad Tariq and Dr. Shahkar Shah. If you can stop sharing your screen, that would be great. So an excellent presentation and overview, and it's very impressive that in a very short time period, you've been able to achieve so much. I will hand it over to our panelists, Dr. Saeed Uzair and Dr. Umar Hayat, for their comments and also fielding any questions that were in the chat. Thank you.
Thank you, Dr. Sarfraz. And first of all, I am really thankful to Professor Dr. Shahkar Ali Shah, Dr. Sarfraz Hasni, and Dr. Mohammad Waleed for such a wonderful presentation, and to the participants. So I think we feel really privileged and honored to host this webinar. To know, because seeing is believing, and these statistics, these objective things, they speak volume. So I'm so happy and delighted that Professor Dr. Shahkar, class fellow, Professor Zulfikar Bhutta joined the session, and he has a question to Professor Dr. Shahkar, that what has been the impact, if any, of the withdrawal of the Sehat Sahulat card in Khyber Pakhtunkhwa on the workload at PIC? So that's the first question from Professor Bhutta, please. Professor Shahkar, over to you.
Thank you, Zair. And I was dreading that Zulfikar Bhutta is going to be joining this this webinar. Anyway, this is a straightforward one. Essentially, 95% of our clinical work is sponsored by and paid off by the Sehat card. And over the last 4 or 5 months, we have had serious funding issues. There is a financial crunch in Pakistan, and that has affected all educational and health programs as well. So there has been, the Sehat card, whenever they don't get enough funding, they switch it off, and then they renew their program, and the government pays off their premiums. So far, Alhamdulillah, they are still sponsoring us. We do get breaks of maybe 4 or 5 days. The issue is not so much, getting funds from the Sehat card. The issue has been the supply chain. And there is a serious disruption of supply chain because the government is not opening LCs. So all the imports are stuck at the ports, and most of our supplies are actually imported. So we are not getting those, and we had to ration and improvise. So far, we have continued. Many of the hospitals stopped their cardiac programs, or they have, very close to shutdown. But we ordered things well in advance because we sense that these things are coming to a pass now. So it's, safeguard so far has not been a problem, except brief interruptions.
Thank you very much, Professor Syed Shahkar. So coming to the supply chain issue, I will be very happy to share with you. I will help and assist you. I have certain connection and certain links. I will discuss with you offline and discuss with you how can I help you and assist you. That's about the supply chain, because that was quite achievable and achieved with the Karachi Institute. So just one more thing about the capacity building to Dr. Mohammad Waleed, that APPNA has started a data analytic course for the young medical students and the postgraduate student, which is starting in June. I will share with you the detail. It's an online 5-day session. So I will share with you on that. But I think it's a phenomenal. And then there are a few more things which are research linkages. Recently, there is a Revive Lab started by a group of APPNA. So they are helping to take the people from ground zero to one for their medical innovation and tech innovation. In the same way, you mentioned about the training or the capacity building in data analytics. So there are 2 volunteers from the North America who will be happy to extend their support. So that is about that thing. Now moving on, we are really, across the time, but we have Dr. Umar Hayat, who has some research offering. So Dr. Umar, are you there?
Yes, I'm here. Thank you very much.
Yeah, it's over to you, please, to share your.
So one quick interjection, though, is that I think a couple of people have also raised their hands. So after Dr. Umar, if you can entertain those. I know we are over time, but maybe.
Yeah, sure.
I will be very brief and short. Thank you very much. Very impressive presentation with the focus on academia as well as on the clinical research. I have been, I know in Pakistan, there are a lot of observational and international studies going on, but we're really trying to bring the investigational trials to Pakistan. And that's where I founded this company by the name of Trial 360. I have been talking constantly to the sponsors in Europe as well as in US. And I don't, after listening to your speech today, I feel that I'm not doing the justice. What I mean is really, I try to present like the prevalence of the disease in Pakistan and a lot of hospitals who are top notch. And then I try to show how many trials they are conducting. But I think I'm going to ask my team to approach you guys. So I really would like to, whenever we have a discussion for a particular disease with the sponsors, I think it would be excellent if you guys can jump on the call and give the deep perspective, because as a Trial 360, as a CRO, I don't think we do a fair justice. Another point I really want to touch upon, when you're putting together the database, it's very, very important. We are also working with the company by the name of Hikma. It's a Silicon Valley based company who is really utilizing that database the hospitals have and connect with the trials, what they call it, trials.gov, and try to match the patients basically who can participate in the clinical study. So I think I would like to introduce you to those guys as well. And we would really love to have the memorandum of understanding with you guys as well. So this way we can bring you guys when we speak with the sponsor. There are a lot of, we're looking into the osteosarcoma, we are looking into colorectal cancer, Fabry is another one disease, the stroke. We are also in atopic dermatitis. Quite a number of trials which will be coming. We are trying to convince our sponsors. Of course, you know how difficult it would be when they all believe that there is no space. So I think I will stop here, but I will try to ask my team to hold a separate meeting with you guys. Back to you.
Great.
Thank you.
Really, really, thank you.
Yeah, so we have Professor Zulfikar Bhutta, and he has something. Waleed, can you request Professor Bhutta to ask the question by himself? So unmute and request him. He has raised hand.
There are two Waleed, so I think you're asking the other Waleed to do that.
No, I'm sorry. I'm asking the tech person, who is the technical host to this thing.
Sorry, sir.
Dr.
Professor
Bhutta.
Zulfikar Bhutta has raised his hand, so please unmute himself and request him to ask his question, whatever, directly. Dr. Bhutta, please.
Sorry, I didn't mean to interrupt, but I wanted to make a suggestion. First of all, Shahkar, Waleed, and Tariq, excellent, great progress. And don't worry too much about the temporary interruptions due to the crisis that we have. This too will pass. I'm a little worried about the funding environment, and that's why I'm making a very practical suggestion to you. You're doing the right thing by investing in data, in systems, in training. We have currently a big opportunity in Pakistan, particularly for female scientists, and already a number of applicants from Khyber Pakhtunkhwa have joined that program, which allows a 1 to 2 years mentored program for training without leaving their institution. A lot of the training is based on self-learning through online courses, but then there is a 1 to 1.5 year period of a funded research mentored project with global experts. So if PIC has, particularly on the younger faculty side, female trainees, people who have a career pathway, or nurses, by all means avail of that opportunity, because I don't see another program in Pakistan offering anything like that for many years to come. As you know, HEC has had a major funding crunch. They've reduced their funding by 5%, and just yesterday they were asked to cut down funding by a further 3%. So I don't think there'll be research funding, Shahkar, like we had through the HEC platform for a while. But there is the funding opportunity through these international collaborations, which are specifically focused on capacity development in Pakistan. So if you have people, this would be a good opportunity to get up to $30,000, $40,000 a year in specific project funding. So Tariq, happy to connect you to people in my team in Karachi, and they will be able to tell you how many have participated and how many are in the pipeline. Thank you.
It will be great. Thank you so much. Thank you.
Thank you, Professor Bhutta. Now we have another hand raised by Sher Muhammad Hazara. So Waleed, can you take him, ask him to unmute and ask the question by himself. Sher Muhammad, please unmute yourself and ask the question.
He is still muted.
Yeah, he's muted. Yeah, I don't know.
So I think in the interest of time, because we're really way over our time.
Yeah. Yeah, go ahead, Sarfraz. Let's formally thanks and close the session.
Sure. So I was just going to say that thank you again for a very wonderful and insightful talk with information about an institute which has achieved a lot in a very short span of time in clinical care, in academics, and in research. So we will regroup, and I think Dr. Zair, Dr. Umar Hayat, and Dr. Bhutta have provided some information about how we can maybe come together and partner, and perhaps we'll have some offline discussions too. So would like to thank again the presenters, and of course Dr. Zair for the power behind all these webinars, and of course Waleed for his technical support, and all the participants for joining. And we will come again and meet with all of you in about 2 weeks from now with yet another in series of these discussions. So thank you so much, and till we meet again.
Thank you. Thank you, Sarfraz. Thank you, Zaid.
Thank you, everybody.
Bye-bye.
Thanks.
Bye.
Zaid, can I call you in a minute?
Sure, sure.
Thank you so much. Thank you.
Thank you.
Thanks, everyone. Thank you. Dr. Waleed, we will be in touch with you. Thanks.
Thank you so much. That will be really great.